Is Johanna ZAMORA. Critical care medicine's acute liver failure is the appearance of several complications rapidly after the first signs of liver disease, such as hemorrhage, and indicates that the liver has sustained several damage, loss of functions of 19% of liver cells.
Hello everybody, welcome back, and today we'll talk about acute liver failure. First of all, we have to know what are the functions of the liver in order to understand how will the liver failure affect the body. The liver functions include 1. Metabolism, 2. Detoxification, 3. Synthesizing albumin, angiotensinogen, 4. Storing multitude of substances, including glucose in the form of glycogen, vitamin A, vitamin D, vitamin B12, iron, and copper. 5. Producing bile. Acute liver failure is one of the liver failure syndromes. Liver failure syndromes are classified into two. 1. Acute liver failure. 2. Chronic liver failure. What is acute liver failure? It is massive brutal necrosis of the liver parenchyma. Severe acute hepatocyte dysfunction with no prior history of liver disease. Evolution of the acute liver failure is from days to weeks. What about the causes of acute liver failure? These include 1. Acute hepatitis, 2. Drugs, 3. Acute intoxications, 4. Vascular, 5. Autoimmune disease, 6. Pregnancy, 7. Metabolic disease, 8. Liver neoplasm, and 9. Sepsis. Acute liver failure have no specific symptoms. These include nausea, vomiting, anorexia, fever, severe fatigue, progressive impairment of mental status. In acute liver failure patients, you can find 1. Jaundice, 2. Fetor hepaticus, 3. A liver size which can be decreased or increased, coagulopathy, 5. Multiple organ failure, and 6. Hepatic encephalopathy. Based on West Haven scale, hepatic encephalopathy grades are divided into 4 grades. 1. Grade 0, which is minimal hepatic encephalopathy. Characteristics of this grade include lack of detectable changes in personality or behavior. 2. Minimal changes in memory, concentration, intellectual function, and coordination. 3. Asterixis is absent. Grade 1 and the characteristics of this grade include 1. Trivial lack of awareness, 2. Shortened attention span, 3. Impaired addition or subtraction, 4. Hypersomnia, insomnia or inversion of sleep pattern, 5. Euphoria, depression or irritability, 6. Mild confusion, slowing of ability to perform mental tasks, and 7. Asterixis, 8. Dysarthria. What about grade 2 hepatic encephalopathy? This grade includes lethargy or apathy, disorientation, slurred speech, inappropriate behavior, obvious asterixis, drowsiness, lethargy, 7. Obvious personality changes, and 8. Inappropriate behavior, 9. Intermittent disorientation, usually regarding the time. As for grade 3, the characteristics of this grade of hepatic encephalopathy include somnolence, but can be aroused, unable to perform mental tasks, disorientation about time and place, 4. Marked confusion, 5. Occasional fits of rage, 6. Speech which is present but incomprehensible. Finally, grade 4 of hepatic encephalopathy, the characteristics of this grade include a coma with or without a response to painful stimuli. What can be noticed in the lab results of a patient with acute liver failure? These include thrombocytopenia, hypoglycemia, increased creatinine, sodium, potassium, phosphates are decreased, increase in the AST, ALT, and alkaline phosphatases, increase in total bilirubin, 7. A serum total protein which can be normal or decreased, 8. Increase in serum ammonia, and 9. A prolonged prothrombin time. Thank you for watching and looking forward to see you in the next video.
Applications in medicine. Liver scan. It is a test that uses radioactive material to help determine how well it is functioning as spleen or liver. How the test is performed. The doctor will inject a radioactive material called a radioisotope into a vein. After the liver absorbs material, you will be asked to lay on the table under a scanner. The scanner can determine where the radioactive material has accumulated in the body, displaying image in a computer. You may be asked to remain still or change positions during the pursuit.
This video demonstrates how to set up and perform an ultrasound scan of the liver. Equipment required includes the following: an ultrasound machine, a selection of transducers, an examination table, positioning aids such as wedge sponges or pillows, a chair, acoustic gel, examination gloves, bed linen and towels, and a sonographer's worksheet. Ask the patient to lie supine on the examination table and make them comfortable with the use of pillows or wedges positioned as required. Put on gloves. Expose the patient's abdomen and apply gel to the right subcostal region from the epigastrium to the flank. Select a transducer of appropriate frequency and confirm the correct transducer selection and preset on the ultrasound machine. Perform a survey of the abdomen and make any necessary adjustments to the machine settings to maximize the image quality. Once the survey is complete, begin the liver scan. The most useful positions for liver imaging include the right subcostal and intercostal approaches. Ask the patient to take in a deep breath and hold it. This displaces the liver downwards and improves the acoustic window. Obtain longitudinal images of the liver with the patient in the supine position, taking note of any abnormalities. A series of 6 longitudinal images are recorded by making small incremental movements. Starting from the left of the midline, moving along the right subcostal margin to the inferior border of the right lobe of the liver. These images should display the following: the left lobe of the liver and aorta, the left lobe of the liver, diaphragm and caudate lobe, the right lobe of the liver and inferior vena cava, the right lobe of the liver, main lobar fissure, gallbladder and portal vein, the right lobe of the liver and right kidney, the right lobe of the liver and diaphragm. Manipulate the transducer until a suitable image of the liver is obtained. If a suitable image is not obtained, a left lateral decubitus patient position and/or an intercostal transducer approach may also be utilized. When a suitable image is obtained, freeze the image. Annotate the scan plane, patient positioned, and structures identified. Note the presence and appearance of any
For the test, you must send a release. In addition, you will be asked to remove any jewelry, dentures, and other metal objects because it can interfere with the operation of the scanner if removed. You may need a hospital gown during the procedure. Pros and cons. Pros, not cons. It has adequate functions. The liver gets numerous toxins and transformers to make them harmless before disposal. Destroys red blood cells and white blood cells against and certain bacteria in the blood. Destroy the toxic waste from the naturally produced by the body, such as ammonia, but also with it, such as alcohol. It has a synthetic function. The liver is involved in the metabolism of carbohydrates, lipids, cholesterol, triglycerides, and proteins. Proteins, albumin. Involved in the production and secretion of blood 600 to 1200 ml per day, which is stored and concentrated in the gallbladder.
The liver is an important organ that sits just under your rib cage, mostly on the right side. It weighs about 3 pounds and is made up of 2 separate sections called lobes, the right lobe and the left lobe. By looking at it under a microscope, you can see that the liver is actually made up of billions of liver cells. 2 major blood vessels, the hepatic artery and the portal vein, continuously bring blood to the liver cells. This blood is important because it allows the liver to perform many important functions, like filtering waste and poisons, processing nutrients, and storing fuel for your body. First, the liver cells filter waste, bacteria, and poisons out of your blood and change these toxic substances into safer ones. The liver also helps change certain medicines into forms that your body can use and then get rid of. Processing nutrients is another function of the liver. Most of the food you eat is eventually processed through your liver before your body can use it. After you eat, your food is broken down into small particles called proteins, fats, and carbohydrates. Your blood carries these building blocks to the liver, where they are used to make and store many of the nutrients your body needs. For example, proteins are broken down into smaller amino acids, which the liver then combines into new proteins. There are many kinds of proteins, each with a specific size, shape, and purpose. Proteins are important for many bodily functions, such as clotting your blood when you get cut. Your liver also makes cholesterol and stores fuel for your body, such as vitamins and carbohydrates and minerals. On a regular basis, your liver sends proteins, fats, cholesterol, and vitamins into your bloodstream to be used for energy and building healthy tissue. Finally, your liver also makes bile, which is a fluid that dissolves fat. This takes place in the small intestine. Fats need to be dissolved so they can be absorbed into the bloodstream. In order for bile to get to your small intestine, the liver cells are connected to small tubes called ducts that eventually come together to form a larger passageway. This passage, called the bile duct, carries bile from the liver to the gallbladder, which is a holding area for the bile. The bile is then eventually delivered into the small intestine. Because the liver does so many important things for your body, you can't live without one.
It has a storage function. The liver stores that soluble vitamins A, D, K, E, and glycogens. Thus, the energy stored in the form of sugar and made available to the body is necessary. Disease. There are many types of liver disease. Some of them are caused by virus such as hepatitis A, hepatitis B, hepatitis C. Maybe a result of drugs, poisons of toxin, or by ingesting too much alcohol. If the liver forms scar tissue disease, is called cirrhosis. Jaundice or yellowing of the skin can be a sign of liver disease. Cancer can affect the liver. Other liver diseases may be inherited, such as hemochromatosis.
The symptoms of liver disease are many and varied, but all indicate a breakdown in the function of this important organ. One of the most common symptoms of liver disease is jaundice, the yellowing of the skin and eyes. This is due to bilirubin from the liver being released into the blood instead of being used in the production of bile. Because of the liver's role in providing vital clotting agents for the blood, liver disease can cause a person to bruise easily. With a diminished supply of red blood cells from the liver, they may also feel weakened or fatigued for no apparent reason. Bleeding from the nose or gums is also a symptom of liver dysfunction. Liver disease can also cause abdominal pain, nausea, and vomiting. If the liver is severely damaged, the body will reroute the blood to the heart around the liver rather than through it. This can cause blood to appear in the esophagus and digestive tract, leading to bleeding or clots showing in stools or vomit. With serious liver disease, other organs are also affected. The gallbladder may become less efficient in digesting fats, and the kidneys can begin to retain water and salts. This leads to a swelling of the feet and legs, or even abdomen. With the blood supply to the heart compromised by a damaged liver, heart failure or palpitations are a real possibility. Liver disease symptoms can occur suddenly or develop slowly over time. It's vital that they are investigated swiftly and that the liver is adequately cared for to prevent such damage from occurring.